Imagine this. You're sitting at home, feeling safe, maybe even healthier than ever, because you're taking the medications your doctor prescribed. You trust that little pill in your hand. After all, medicine is supposed to heal us, right? But what if I told you that the very medications you rely on every day might be silently increasing your risk of a deadly heart attack? Yes, you heard that right. Hidden inside the tiny capsules and tablets in your medicine cabinet could be a ticking time bomb for your heart. And here's the terrifying part. Millions of people take these drugs daily, completely unaware of the danger. Some of these medications are among the most commonly prescribed in the world. They're given out casually, like candy, for conditions ranging from pain to allergies to infections. But behind their benefits lies a dark truth. They can quietly stress your heart, harden your arteries, and, in the worst cases, trigger a sudden, life-threatening heart attack. Now, I'm not here to scare you unnecessarily. My job is to warn you and protect you with the facts. Facts that many people don't hear until it's too late. Because, let's face it, nobody wants to imagine that the medicine meant to keep them alive could actually be doing the opposite. Here's what's even scarier. For many people, the symptoms are silent. No pain, no obvious warning signs, just a slow buildup of risk until one day everything changes. A normal morning suddenly becomes the worst day of your life. In this video, we're going to uncover 5 common medications that could quietly increase your risk of a heart attack. Some of these will shock you because they're so ordinary. You might even find one sitting in your cabinet right now. But don't worry. I'll also explain what you can do about it, what alternatives exist, and how you can protect your heart without giving up your health. Because knowledge isn't just power, it could be the difference between life and death. So stay with me until the very end. Your heart may literally depend on it. 1. The painkiller problem. NSAIDs. Let's start with one of the shocking culprits, painkillers. Now, I want you to pause for a second and think. How many times in your life have you reached for a pill to ease a headache, joint pain, or muscle soreness? Probably countless times, right? For many people, it's a daily routine. Pop an ibuprofen, naproxen, or another over-the-counter pain reliever, and move on with life. These drugs belong to a group called NSAIDs, non-steroidal anti-inflammatory drugs. And while they're fantastic at calming pain and inflammation, research has shown something terrifying. Regular use of certain NSAIDs can increase your risk of a heart attack. But why? It all comes down to how they work. NSAIDs block enzymes in your body that trigger pain and inflammation. That sounds great on the surface, but here's the dark twist. They also affect enzymes that protect your blood vessels and keep your heart safe. The result? Your blood may clot more easily, your arteries may stiffen, and your blood pressure could rise, all of which set the stage for a heart attack. In fact, several large studies have found that even short-term use of high doses of NSAIDs can dramatically raise the risk of heart problems. The FDA has even issued warnings about drugs like ibuprofen and naproxen, noting that the risk can appear in as little as a few weeks. Imagine this. A 55-year-old man with mild arthritis takes naproxen daily to ease his joint pain. He feels fine, maybe even better than fine because the drug helps him stay active. But what he doesn't realize is that every pill is nudging his heart closer to danger. One morning while going about his routine, he suddenly feels chest pain. By the time he gets to the hospital, it's too late. His family is shocked. How could this happen to someone who just had arthritis? The truth is chilling. The very medication he trusted may have played a role. And here's the kicker. Millions of people worldwide rely on NSAIDs, often unaware of these risks. That's why doctors recommend using the lowest possible dose for the shortest time necessary. But how many people actually follow that advice? It's not about scaring you away from pain relief, it's about making you aware. If you rely on NSAIDs daily, it might be time to talk to your doctor about safer alternatives for long-term pain management. 2. The surprising risk in antacids, proton pump inhibitors, or PPIs. Now, let's move to the second shocker, a drug category most people never suspect: proton pump inhibitors, or PPIs. If you've ever had acid reflux, heartburn, or GERD, chances are you've taken a PPI. Names like omeprazole, Prilosec, esomeprazole, Nexium, or lansoprazole, Prevacet, might sound familiar. These medications are lifesavers for millions of people who suffer from the burning discomfort of stomach acid creeping up into the throat. They're so common that you can find them not just at pharmacies, but also in supermarkets, stacked neatly in rows. But here's the hidden danger. Studies suggest that long-term use of PPIs may increase the risk of heart problems, including heart attack. How could a stomach medicine affect the heart? The answer lies in how PPIs change your body's chemistry. By shutting down acid production in the stomach, they alter mineral absorption, gut health, and even the way blood vessels function. One theory is that PPIs can reduce levels of nitric oxide, a molecule that helps blood vessels relax and stay flexible. Without enough nitric oxide, your arteries may become stiff, your blood pressure may rise, and your risk of cardiovascular events goes up. Here's a real-life example. A 62-year-old woman has struggled with acid reflux for years. She starts taking omeprazole daily, and the relief is almost magical. For the first time in a decade, she can eat her favorite foods without pain. But after several years, she notices shortness of breath and chest tightness. Tests reveal narrowing in her coronary arteries. Doctors can't say for sure, but research shows a troubling connection. People who take PPIs long-term may have a significantly higher chance of developing heart disease compared to those who don't. In fact, one large study involving nearly 3 million patients found that PPI users had a 16% higher risk of heart attack. That might not sound huge at first glance, but when millions of people are taking these drugs, the impact is massive. And what's worse, many people stay on PPIs for years, even though guidelines recommend only short-term use unless absolutely necessary. That means millions could be unknowingly raising their heart attack risk simply by treating their heartburn. A pattern emerging. By now, you might have noticed something unsettling. Both of these medications, painkillers and antacids, are among the most common drugs in the world. They're trusted, they're widely available, and they're often used without much thought. Yet behind the relief they provide lies a risk that many people never hear about. And here's the uncomfortable truth: NSAIDs and PPIs aren't the only ones. In the next section, we'll explore 3 more medications that might shock you even more, because some of them aren't just common, they're practically everywhere. So, before you reach for that next pill, stay tuned. The next part of this journey might make you look at your medicine cabinet in a whole new way. 3. Diabetes drugs, the double-edged sword. Now this one shocks a lot of people. How can a drug meant to control blood sugar, something that protects your heart, actually increase the risk of heart attack? The truth is complicated. Let's talk about a class of diabetes medications called sulfonylureas. Examples are glyburide, glipizide, and glimepiride. These drugs have been used for decades to lower blood sugar in people with type 2 diabetes. They work by stimulating the pancreas to produce more insulin. On the surface, this sounds like a good thing. More insulin, lower blood sugar, healthier life. But here's the dark side. By forcing the pancreas to churn out more insulin, sulfonylureas can sometimes cause severe blood sugar crashes, hypoglycemia. When your blood sugar drops too low, your body releases stress hormones like adrenaline, which raise blood pressure and put a strain on your heart. Repeated episodes of hypoglycemia have been linked to sudden cardiac events. Even more alarming, some studies suggest that sulfonylureas may actually damage heart tissue by blocking certain protective channels in the heart muscle. One major study found that people taking sulfonylureas had a significantly higher risk of dying from heart problems compared to those on newer diabetes drugs. Picture this. A 68-year-old man with type 2 diabetes has been faithfully taking his glyburide every morning. His blood sugar readings look decent, and his doctor is pleased. But one evening, after skipping dinner, he suddenly feels dizzy, breaks into a cold sweat, and collapses. His blood sugar has plummeted, triggering a cardiac arrest. He never saw it coming. Now, this doesn't mean everyone with diabetes should panic. There are many newer and safer diabetes drugs available today, including SGLT2 inhibitors and GLP-1 agonists, which may actually protect the heart. But the key lesson is this: some of the older medications, while effective for blood sugar, may come with hidden cardiovascular dangers. The fourth group might surprise you even more: antidepressants. Depression itself is already linked to a higher risk of heart disease. But here's the twist: some of the very medications used to treat it may also raise heart attack risk, depending on how they affect the body. Take SSRIs, selective serotonin reuptake inhibitors, drugs like fluoxetine, sertraline, and citalopram. These are among the most prescribed medications in the world. For many people, they're life-saving, restoring hope and stability. But research has shown that in some cases, SSRIs can increase the risk of abnormal heart rhythms, arrhythmias, which can set the stage for a sudden cardiac event. Then there are tricyclic antidepressants, TCAs, older drugs like amitriptyline. These are even riskier. They can directly affect electrical signals in the heart, raising blood pressure and making heart attacks more likely, especially in older adults. Let me paint a picture. A 59-year-old woman battling depression is prescribed amitriptyline. Slowly, her mood improves, but one night she wakes up gasping for breath, her heart pounding irregularly. She collapses before help arrives. Her family never suspected that the antidepressant she relied on carried such risks. Now, does this mean antidepressants should be avoided at all costs? Absolutely not. For many people, they are essential for mental health. But it does mean that patients and doctors need to carefully weigh the benefits against the risks, especially if someone already has heart disease or risk factors like high blood pressure. You've now seen the shocking truth. 5 of the most common medications in the world, painkillers, antacids, diabetes drugs, antidepressants, and hormone therapy, can all quietly raise the risk of a heart attack. And the scariest part? These aren't rare drugs hidden in some secret pharmacy. They're in millions of homes, purses, and bathroom cabinets right now. So here's the big question. What should you do if you or someone you love takes these medications? Emergency alert. Step 1. Don't panic, but don't ignore this either. The first thing I want you to remember is this: just because a drug can increase risk doesn't mean everyone who takes it will have a heart attack. Risks depend on many factors: age, dose, lifestyle, family history, and overall health. So don't rush to throw your pills in the trash. That can actually be dangerous. Instead, take this new knowledge as a signal, a warning light on the dashboard of your health. Emergency alert. Step 2. Talk to your doctor. Ask the right questions. Here's something most people don't realize. Doctors don't always bring up these risks unless you ask. Not because they don't care, but because in the short time they have with each patient, they focus on the immediate problem. So, the next time you see your doctor, bring this up. Ask questions like, is this the safest medication for me, given my heart health? Are there newer alternatives with fewer risks? What lifestyle changes could help me reduce my dependence on this drug? When you ask smart questions, you take control of the conversation. And trust me, good doctors respect proactive patients. Emergency alert. Step 3. Know the safer alternatives. Here's the good news. In almost every case, there are alternatives, both medical and lifestyle, that can reduce your need for risky drugs. Instead of relying heavily on NSAIDs for pain, explore physical therapy, gentle exercise, turmeric supplements, or newer anti-inflammatory meds. Instead of long-term PPIs, work on diet adjustments, weight management, smaller meals, and elevating your head while sleeping. Instead of older diabetes drugs, newer meds like SGLT2 inhibitors or GLP-1 agonists may lower blood sugar and protect your heart. Instead of high-risk antidepressants, certain SSRIs are safer, and lifestyle changes like exercise and therapy can support mental health. Instead of oral hormone therapy, lower-dose patches or non-hormonal treatments may carry fewer risks. It's not about avoiding all medication. It's about choosing the right one for your body and your heart. Emergency alert. Step 4. Strengthen the one organ you can't replace. Let's face it, no pill in the world can fully protect you if your lifestyle is working against your heart. So, while you're reviewing your medications, also ask yourself, am I moving my body every day? Am I eating more whole foods than processed foods? Am I managing stress or letting it silently eat away at me? Am I sleeping enough to give my heart the rest it deserves? These may sound like simple questions, but they're the real foundation of heart health. Every small step, a daily walk, a handful of nuts instead of chips, turning off your phone 30 minutes earlier at night makes a difference. Emergency alert. Step 5. Watch for the warning signs. One of the most dangerous things about heart attacks is that the early warning signs are often ignored. Don't wait until it's too late. If you ever feel sudden chest pressure or heaviness, pain radiating to your arm, jaw, or back, shortness of breath for no reason, nausea, dizziness, or cold sweats, don't brush it off. Don't say, it's just indigestion, or I'll wait and see. Get checked immediately. Minutes matter. A story to remember. Let me leave you with this. A 62-year-old man once said to me, "Doc, if I had known my stomach tills could affect my heart, I would have asked more questions." He had been on PPIs for years without ever realizing the risks. After a minor heart scare, he changed his lifestyle, switched medications, and today he walks 3 miles every morning with his wife. His message was simple: awareness saved my life. And that's exactly what I want for you. Not fear, not paranoia, but awareness. Final thoughts. Your medicine cabinet may hold both healing and hidden dangers, but with the right knowledge, the right conversations, and the right choices, you can tip the balance in your favor. So if you're watching this, remember, knowledge is power, action is protection, and your heart deserves both. If this video opened your eyes, please hit the like button. It helps more people discover this life-saving information. Share your thoughts or questions in the comments. I love hearing from you. And don't forget to subscribe and turn on notifications, because every week we uncover another health truth that could change or even save your life. Stay informed, stay empowered, and above all, protect your heart.